Welcome to another edition of the Invisible Wheelchair Podcast. I'm Donald Grodoff, family coach with FamilyOCD.com and FocusedHealthyFamily.com. In the Invisible Wheelchair Podcast series, I delve into the hidden characteristics of OCD, anxiety, and anxiety disorders. The things that most people don't see, that are behind closed doors and shut within the mind about anxiety. My goal with these podcasts is to bring about awareness of obsessive-compulsive disorder, or OCD. Understand that I am not a doctor, therapist, or counselor, and the content, information, resources, and ideas that are talked about and brought up here in these podcasts are things that I have used, discovered, or have been recommended to me, and I always recommend to seek additional professional help in finding solutions for yourself. Thank you for listening and enjoy the podcast. This podcast was recorded May 29, 2017. This is podcast number 11, called Do I Go to Drugs? Last podcast we talked about I Know Best. And this is another area where that really fits in too. Do I know best whether to begin to use medication, drugs, for my child or from myself or whomever is the one suffering from OCD. And it's a tough decision to have to make, whether I'm able, to do this naturally or do I need to bring in the drugs to help calm it down. And to me, it's always a dilemma for parents because I truly believe most parents don't want to put their kids on a medication or a drug. And so it becomes a torment in their mind, a debate in their mind to whether to do this or not. I know myself in my own personal side of it, my wife and I struggled with that idea, that thought for a long time. We ended up doing a fairly minor dose of medication at the very point of where it got to be extreme and where it was kind of the last straw, the last thing that we did. But it was still a debate and not so much that we debated with each other on this particular case. That no, I don't want to do drugs, and my wife was saying yes. It wasn't like that. It was more of, wow, do we really need to go to that point? It was a tough decision because we both really did not wish to have our kids on any kind of medication. And so it had to be at its worst point, which is what happened for us. It got to the point where we had to make that decision because it was not, no matter all the natural things we did, and I'm going to talk about those in just a minute here, it was hard to get my daughter to do those things because her mind raced so bad that those things could not even penetrate enough to be able to get her to stop to do that. That's how bad it was. So when it came down to it, the final straw, we had too many nights of the battles, too many nights. We had too many times we called an ambulance to have her taken away, which didn't happen, luckily. Both times we turned it away. But at that point, we started knowing that we had to do something. My daughter had to sit in front of the TV 24/7 because if she shut it down, if it got quiet, her mind would turn into a racetrack of thoughts. So, I really believe no parent wants to go down that route of doing medication. Because I think this is, we're talking about here about OCD and about, I talk more about children, But really, I don't think any of us really want to be on any kind of medication if we can help it because we know the side effects. Um, and so, one of the things I wanted to talk about in this podcast is that going to the medication side of it, going to the drug side of it, takes some effort to really do it correctly. Because there has been different studies that shown, that some SSRIs, which is the common medication for things like OCD, do not always work for people. Not everybody that those will work. I don't know the percentage. I probably need to look that up. I should have looked that up. Um, but so what I like to talk about is the idea of having them tested. There's like pharmacology, I think, is one method of finding out whether a certain drug works well for them. The other part of it, whether they intake it properly. And that's one of the things that we found out personally, and I've seen with with clients too, is that that drug may not contradict with the person, but it doesn't get intaken as well. It doesn't absorb as well. It doesn't go into the system as well, so it's not effective. So it's looking at, first off, is this medication suitable and compatible for the person who's suffering the OCD? Then, not only is it compatible, but does it absorb into their system well? Do they have blockers that block certain medications, certain chemicals, certain things from being intaken into the system? And like I said, we ran into that ourselves. We ran into a situation where my daughter had a hard time with absorption. And so we had to look at some things to help that also, on top of taking the medication. So that's one of the big points here, is that we want to make sure that that we're getting the right medication and that it is being absorbed by the skin. And I guess also, really, if you think about it, and that goes along with the right medicine, is SSRIs the right stuff for this? And I guess it goes back to two, of the diagnosis, to make sure that this is the right stuff. The other thing is, we talked about pandas and pans before. And I think there you need to understand too that there can be some medication there, antibiotics that have the possibility of turning pandas and pans around. Usually I think it's if it's caught early. So again, you want to test for tolerance. What drugs work with the OCD person, and also you want to look at, is their system able to absorb and take in and on top of that is, what is the best method? Is it taken better in liquid form? Is there a natural remedy that would equal what they need to take in the medication? So there's a lot of things to think about when you're doing this. Also read up on the side effects, because the side effects could be worse than what you're going through. So you want to make sure, and whether those side effects will kick in. And I had an example with my one of my relatives who has Parkinson's, and that he was given medication that actually contradicted his Parkinson's and made it worse. So that's Parkinson's, that's not OCD, but just to know that we really want to understand the side effects and how they can affect it. And maybe instead of taking, if there are side effects part of it, maybe taking a natural remedy to be able to curb the side effects might be a solution too. And understand too that with that you need somebody that can manage the medication. So it's going to probably turn to a psychiatrist, and again that is expensive, depending on your insurance. That can be very expensive, having a psychiatrist that basically just manages them. You know, you have to see them. From what I see so far is they don't usually extend that out very far. You usually get a month's worth of the medication, maybe 3 months worth of it, before you have to see the psychiatrist or the manager of the medications that does the work for you, before they'll give you another prescription. They just want to keep track of it. Now, what I also wanted to, you know, talk here a little bit about too, and we'll go through it more. I'm going to go through in probably each one of these with a podcast, but I wanted to mention them and talk briefly about the natural options that you have for OCD. And the first one I really want to talk about is ERP therapy, exposure response prevention. This is something we used. All the ones I'm going to mention here we used ourselves personally, and now I've used it with clients. But ERP was one of the most effective tools we use personally, and then what I've done with clients, it seems to be effective also. ERP is, as its name implies, exposure, response, and prevention. Being exposed to the triggers in a methodical method. It's a slow, methodical method for which you are exposed to your triggers, to be able to learn to overcome the anxiety that comes with those triggers, so the trigger isn't the same effect in the long run as it was with the OCD. So learning to respond to those triggers properly, and then prevent those triggers from being the trigger, from being the source of rearing up OCD or bringing up OCD. It is a very good method. I coach people in the ERP, helping them take the steps, helping them be there on a personal basis, working along with the therapist, working along with the psychiatrist, to be able to coach them through the steps, because they can be very difficult, takes a lot of patience. It's a time-consuming therapy, but it is probably one of the best ones out there. And again, I'm going to do a podcast on it pretty soon, about the steps and what's all involved. But it takes, a lot of times it's helpful to have an outside source, because when you're the parent, when you're the caregiver, you can tend to be a little close, and it can be more difficult to do the things that you need to do. The next one, of course, I'm going to mention is of course EFT, Emotional Freedom Techniques, which is my training, which is my background, which is what I do every day, and I help people through that. And what I've found is, because one of the things that sometimes is recommended for OCD is cognitive behavioral therapy, talk therapy basically. And really what that has been found more and more, that it's not as effective for OCD. I think what I know of and what I've read on, is that it just causes these thoughts to start swirling in your head. What I have found with EFT, because EFT, the tapping process, really involves a type of cognitive behavioral therapy. There is a lot of talk in it, because we're using the words and phrases that we're tapping on. But here's the difference in it. The EFT, the tapping part of it, makes it much more effective, much faster in how it works, so that it doesn't have the same effect as just talk therapy. It's very effective, and I used it with my daughter. I tied it in with the ERP, and it made the ERP go faster and work better. So I highly recommend that. And again, I'm trained in it and would be happy to work with you in it. Movement therapy. Now, there is and I need to, I believe I actually have her up on my site. I work with a lady named Adele Scheisel, and she does what I call movement therapy. It is specific exercises or movements. You know, I do a simpler form of it with my clients called Brain Gym, which is specific movements that help repath the brain, that help motivate the brain, excite it, get it back functioning and focusing better. Um, so we use this with my daughter, and I've used it with my clients, and I find it fascinating for one, and two, I find it effective. So that's another thing that you can do. We did some hypnotherapy with personally. Now I haven't done that much with clients. I have had some clients that have done it. I don't do it. There was somebody that came in that did it for us. But it did show effect, and I was impressed with it. And finally, I'll mention, AlphaStim device became a very big tool for us too. It was very effective. It helped personally. It helped the whole family calm down. It helped us sleep. It helped my daughter and her OCD issues calm down, and it also helped her to sleep. So it's a very effective device, and I can talk more about this. You can also find out more about these different some of these. I don't right now. I don't have movement and hypnotherapy on my sites, but I do have EFT, the ERP, and the AlphaStim up on the familyocd.com site. So if you want to find out more about them, feel free to go up to the site and investigate there. And again, I'm always more than happy to help you. So thank you, and I hope this has been helpful for you to find out a little bit about some things you might want to do when it comes to medications. Take care. This concludes this podcast. Please remember to leave comments for me, because that really helps me to understand what you're looking for and helps give me fodder for the next possible podcast. Also, I'd love to hear your invisible wheelchair story if you're willing to share it. If you are, feel free to go to invisiblewheelchair.com and click on Tell Your Story. Now, if you've heard these things and you feel like you need further assistance or some help in what you're going through, and you want to spend some time with me working through those issues, then feel free to book a session at focusedhealthyfamily.com or familyocd.com, or simply call me at 704-562-1630. Finally, don't forget there is a tap-in recording following this podcast you may want to take advantage of. I hope you've enjoyed this podcast and will join me for the next one. Remember, keep tapping, talking, and transcending your life into new heights. Thank you, and have a great day.